My name is Sarah Andrews, and I am one of the physical therapists that works at Life in Motion Gym, and we are going to be talking about osteoporosis and osteopenia today. So just a disclaimer, the information provided in this presentation is not intended to be a substitute for diagnosis or treatment of specific impairments. Always seek the advice of your physician or other healthcare provider with any questions you may have regarding specific ailments or injuries. So just as a beginning discussion, has anyone been diagnosed with osteoporosis? What do you know about osteoporosis? And what treatments, care have you tried for osteoporosis? So let's talk about what osteoporosis is. So bone is basically remodeling. It's living tissue that builds up and breaks down. And osteoporosis occurs when the creation of new bone does not keep up with the loss of old bone. So this causes bone to become weak and brittle, and even a mild stress like a fall or a cough to that body can sometimes cause fracture. So just to show you here, this here is a bone with normal bone density, and then this is a bone with someone who has osteoporosis. So this typically affects 1 in 3 women and 1 in 5 men over the age of 50. Osteoporotic fractures are associated with higher morbidity rates and increased mortality rates. The most common places for fracture are the back, the hips, and the wrists. And there's not really symptoms in the early stages other than, getting your DEXA scan and seeing that you're in that osteoporotic or osteopenic range. But in the later stages of osteoporosis, you'll see some back pain, the loss of height over time, and then just like in this picture, this progression of that stooped posture. So how this is diagnosed typically is through bone mineral density tests, like a DEXA scan. And if you're a woman in postmenopause or a man who's over 50, your T-score or your result is going to be a T-score. The T-score is the difference between your bone mineral density and 0. And 0 or above is healthy bone. If your T-score is lower, then you're at risk for fracture or osteoporosis. So just to show you the chart here, 0 and above is normal. And then as you get lower into the -1 to -2.5, it's that low bone mass, or they call that the osteopenia. This is their stage before osteoporosis. And then osteoporosis is -2.5 or lower. So just some risk factors for osteoporosis. There's ones you can change and ones you can't. The ones you can't necessarily change are your genes, your family history, your gender, menopause, and then history of broken bones. The factors you can change are low body weight, high salt and sugar diet, tripping and falling, physical inactivity, smoking, and drinking too much alcohol or caffeine. So here are some medications that increase the risk of osteoporosis. These include steroids, cancer treatments, and anti-epileptic medications. And here are some conditions that increase the risk of osteoporosis. These include RA, any type of condition that immobilizes you for a period of time, such as stroke, hyperthyroidism, parathyroid disease, Crohn's, and celiac disease. And then the big one is low levels of estrogen in women and low levels of testosterone in men. Estrogen basically slows the natural breakdown of bone. So without that multitude of estrogen, especially when people go into menopause and that estrogen lowers, that natural breakdown speeds up. So today we're going to be talking about some non-pharmacological management of osteoporosis, and we're going to go into 6 different categories here. So we're going to talk about calcium, vitamin D, and protein intake, weight-bearing exercise and muscle strengthening, balance program, fall prevention techniques, smoking cessation, and then limiting alcohol and caffeine. So we're going to start with the calcium, vitamin D, and protein. So calcium intake recommendations for men 50 to 70 years old are 1,000 milligrams a day. For women over the age of 50 and men over the age of 70, it's 1,200 milligrams a day. And typically, especially physicians, they tend to recommend getting more calcium in your diet over like supplemental calcium, because if calcium is not absorbed into your bone, it can be absorbed into your bloodstream and it causes a multitude of different issues such as kidney issues or heart issues and things like that. So we want to make sure that calcium is being absorbed into the bone, and we'll talk a little bit more about that as we get into the vitamin D portion of things. So here are just a list of some calcium-rich foods. These include yogurt, milk, cheese, so like your dairy products, spinach and other deep greens, sardines and salmon, tahini, and then fortified juices or cereals. Here are just some dietary examples of calcium and how much calcium is in each one. Okay, we're going to move on to vitamin D. So vitamin D is a key component in calcium absorption and bone health. It's recommended that men and women take 5,000 to 10,000 IUs a day, and that's typically what supplements, that vitamin D supplement is, between 5,000 and 10,000. And not to scare you with the 1,000 IUs here, comparing that to milligrams, 10,000 IUs is less than 20 milligrams of vitamin D. So if you're getting 10,000 IUs of vitamin D a day, that's pretty good. But you need vitamin D with calcium to help that calcium be absorbed into the bone. You also need K2. So supplement-wise, you want to make sure if you're taking a vitamin D supplement that vitamin D, it usually says vitamin D3/K2. You want to make sure it has that K2 because you need all three of those things for everything to be absorbed into your bone properly. Here are just some nutrient-rich foods for vitamin D, and these include salmon, herring and sardines, canned tuna, egg yolks, mushrooms, and then your fortified milks and cereals and juices. So these are just some dietary examples of vitamin D and the IU levels in each. The big thing I want to point out here is looking at egg yolks. So for hens raised indoors, there's 37 IUs in an egg yolk of vitamin D. So if we look at like a free range, so that's what that free range means. It means those hens can like go outdoors. There's 3 to 6 more times vitamin D in those egg yolks than your typical eggs. So you want to look for like organic free range eggs here to get the most vitamin D out of those egg yolks. Sunlight is another big thing. So skin exposed to sunlight increases vitamin D production. The best time for sun exposure is typically around noon, but again, it depends on season, where you're located, and 10 to 30 minutes of sunlight is recommended to get the daily dose, but again, that is dependent upon location and where you're located. Like I think the months in Pittsburgh between October and May, it's really hard to get your daily dose of vitamin D just through the sun, and this varies person to person. And the other thing is through a window or through a windshield, you're not getting the type of light that you need for that vitamin D production. So it has to be physically outdoors and pretty direct sunlight there. So let's move on to protein. Protein is huge in bone health. It's also huge in muscle health. So that whole musculoskeletal system, protein is important for. Recommended protein intake is 1.2 grams per kilogram of body weight daily. So for example, if you have someone who's 150 pounds, we convert that to kilograms, which is 68, and then you multiply that by the 1.2 grams. So someone who's 150 pounds and over the age of 50 should be getting 82 grams of protein a day. So a serving size of meat is typically 3 to 4 ounces, which is a deck of cards or like the size of your palm. And then this just shows like what that 3 ounces, how much protein is in each. So for steak, 21 grams, chicken breast, 26, for salmon, 17. Now, our portion sizes are much bigger now. So if you're going out to eat or you're typically being served like 6 to 8 ounces. So these things would double or even go up a little bit more if you're eating that 6 to 8 ounces. So these are other protein sources, and they include eggs, quinoa, green peas, nuts and seeds, and beans. Quinoa is the only plant-based protein that is a complete protein, so it has all of those amino acids that an animal protein does. The rest of them are incomplete proteins. As for protein supplements and bone health, there have been studies out there to show that with the use of protein supplements in patients with hip fracture, this minimizes bone loss, it decreases the risk of infection, it decreases the length of hospital stay, and it increases functional recovery. Supplements are really tricky because for calcium, protein, and vitamin D, you want really high quality supplements that are third-party approved, typically organic. There's a couple layers of approvals that you want from these supplements. One good supplement brand is Nature Frontier, which Marla, our board-certified health and wellness coach, uses and provides to her clients. So if that's something you're interested in learning more about, you can talk to her. Another good brand is Zymogen. They have a multitude of different supplements, and those you can get online. So this is just a practical meal example. So for breakfast, you have 1 cup of 2% milk, 1 pack of instant fortified oatmeal, and 2 free-range eggs any style. And then it shows just the calcium, vitamin D, and protein. And then for lunch, we have a 6-ounce grilled chicken breast sandwich with 1 slice of cheddar cheese, and then a spinach and kale salad. And then for dinner, 1 cup of fortified OJ, salmon fillet, and 1 cup of cooked spinach. So just with that practical meal example, if you add everything up, you reach all of those goals. So total calcium, vitamin D, and protein. And actually, this right here, we actually want between 5,000 and 10,000. So I would say we're actually not hitting the vitamin D goal here. That is something I would have to look at and change. But that is also something you can supplement with your supplements, getting that 5,000 to 10,000 IUs a day. Weight-bearing exercise and muscle strengthening is what we're going to talk about next. So this is huge. With osteoporosis, we want to get into a good exercise program. Weight-bearing is when you are physically bearing weight through your joints. So for the leg joints, it's going to be in standing. So stairs, squats, lunges, things like that. For the arms, it's going to be, again, when you're physically putting weight through the arms. So a push-up, a plank, on your hands and knees, those kinds of things. We also want to supplement that with resistance training or non-weight-bearing strengthening. So for the arms, anything where you're using hand weights for curls or presses, things like that. And then for the legs, knee extension, hamstring curls, those kinds of things where you're not physically bearing weight through. I think a good mixture of both types of exercise are beneficial for muscle strengthening and then the weight bearing for bone density. Additionally, we want to include some flexibility exercises, some core strengthening, and then some posture exercises. Especially for those with the stooped posture, we really want to work on that. And just like muscle strengthening or bone density, if we work on the posture, we can improve it. So these are just some things to avoid or be cautious with, depending on your level of osteoporosis and where the osteoporosis is located. So bending forward and twisting, especially with heavy loads. So we want to avoid like bending the back this way, and more so using our legs, keeping our spine neutral. When we're lifting heavy things, we want to make sure we have proper lifting mechanics. If not, you want to ask for help in this area because it's not worth putting your back at risk. And then other things to be wary of are high impact activities, so running, jumping, and sports activities. And this all really depends, like I said, on the level of osteoporosis and where it's located. So just going into pain management, because a lot of times we do see some low back pain or wrist pain, things like that. Some things to help augment that management is just ice and heat, topical creams, NSAIDs or Tylenol, and then movement and exercise. I typically go off the pain model. So low is 0 to 3, moderate is 4 to 6, and high is 7 to 10. If you're in this lower range with the activity, I usually say that's okay. If you start getting up into the moderate or high levels of pain, we want to hold off or modify the activity. And then if the activity increases pain by 2 or more points on the pain scale, that's when you want to avoid or adjust. So we're going to go into our balance program next. So there's all different types of balance exercises you can work on: dynamic, reactive, static, exercise for stability. And these can all be generated by a trainer, a physical therapist, your gym, or you might have home exercises that you do for this as well. These are good things to be doing regularly, just like the posture, the strength, the flexibility. If we want that to improve, it needs to be done pretty consistently on a regular basis. So to find a balance program in your area, you can talk with us. Here's just some more information. If you are looking into you can contact your area agency on aging. So for fall prevention techniques, we'll get into that. So you always want to talk to your doctor, you want to talk to your other specialists. It's always good to have like a team around you around these things. You want to be honest about your concerns. You can ask for your notes, you want to ask questions. A big thing with fall prevention is medication. So especially if you're taking multiple medications at once, you want to look out for those side effects or drug interactions, because it does increase the risk for like dizziness and falling. Take them only as prescribed, keep a list, set reminders, and report side effects with your doctor. Poor vision and hearing loss can lead to increased risk for falling, so we want to take care of our vision and hearing. So you want to get your eye exam, you want to make sure you're being aware of hearing changes. The other big thing is lighting up your home visually. So especially at nighttime when it's dark and then we get up to go to the bathroom in the middle of the night, it's always good to have night lights or a switch that's close to where you can turn on some lights to make sure you can navigate that area. Our visual system is one of our main balance systems. So without the visual system, it puts us at increased risk for falling. So just some tips on making your home safer. You want to plan ahead and clear the way. So make sure there's no obstacles or anything in your way as you're moving throughout your day and doing your daily activities. Again, light it up, and then keep a chair in your bedroom to sit down when dressing or putting on shoes. We can also make bathing easier with additional support. So you can add a grab bar, a shower seat, an adjustable shower head. And you want to keep items frequently used at waist height or shoulder height so they're easily accessible and you're not reaching overhead too high, putting your body in a compromised position, or having to put pressure on your back and bend too low to grab something. And finally, we will talk about smoking cessation and alcohol and caffeine consumption. So for smoking, you want to talk with your doctor and other healthcare provider about an individualized smoking cessation plan. So this is how smoking affects our bones. So it impedes the hormone calcitonin, and calcitonin helps build bone. It kills osteoblasts, which make bone, and it increases cortisol, which leads to the bone breakdown. So all of these things are increasing bone breakdown and decreasing bone buildup. It also reduces blood supply to our bone and many other body tissues. It damages blood vessels, which limits the blood supply and increases your risk for fracture. As for caffeine, the recommended daily intake for anyone, not just somebody with osteoporosis, is under 400 milligrams of caffeine a day. So 400 milligrams of caffeine is about 4 8-ounce cups of coffee. And usually our mugs, you just want to watch this and be mindful, because our mugs are about 12 to 16 ounces. So we're already getting 1.5 to 2 servings of that caffeine by just drinking that 1 mug of coffee. So here are some alternatives: some black tea, Earl Grey tea, green tea, and decaf coffee. So if I have someone who's a big coffee drinker, we try to switch to decaf during the second part of the day, because that has significantly lower caffeine than your typical 8-ounce cup of coffee. So how caffeine affects our bones. Caffeine's a diuretic, so this increases the passing of urine, which increases calcium loss in the urine, which decreases the calcium absorption in the body. So decreased calcium leads to increased bone loss over time, which decreases that bone strength and increases that risk for fracture. As for alcohol, in my opinion, No alcohol is beneficial for the body in any way. But daily recommendations, so no more than 1 drink in a single day and no more than 7 drinks in a week for females. For males, no more than 2 drinks in a single day and no more than 14 drinks in a week. For adults age 65 and older, whether you're male or female, it is the same as the younger female. So no more than 1 drink in a single day, no more than 7 drinks in a week. And this is how alcohol affects our bones. So it decreases estrogen and testosterone production. It suppresses osteoblasts, and these are the cells that make bone, and it decreases bone density, which increases risk for fracture. And heavy drinking in adolescence and early adulthood can lead to increased risk for osteoporosis later in life. So just a review of everything that we've talked about today. You want to begin a plan for adequate calcium, vitamin D, and protein intake. You want to get into an individualized weight-bearing exercise and muscle strengthening program. You want to begin a balanced program to decrease fall risk. You want to use the fall prevention techniques. You want to develop a smoking cessation plan if you do smoke. And then you want to limit alcohol and caffeine consumption. Thank you.